Good morning. Welcome, and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. Spring is in the air as evidenced by our uplifted spirits, longer days, itchy eyes, and runny noses, and is wholly welcome nonetheless. We'll start off today with an update on healthcare issues in the news. We'll then look at social media and the impacts on various aspects of our lives, including business strategy. Social media probably conjures up lots of thoughts for you. According to Simple Learn, people have become more conscious thanks to social media. It serves as a channel for information, thus paving the way for innovation and success. Mind Magics reinforces that social media is useful for education, reaching a large audience, building brand, reaching special interest groups, staying up to date, connecting with new people, decreasing loneliness, decreasing depression, while helpguide.org cautions that heavy social media use can increase the risk of depression, anxiety, loneliness, and even suicidal thoughts. So as you can see, we have a lot to discuss today. Let's get to it. Our panelists today are Dr. David Prescott, Associate Professor serving as Coordinator of Health Administration and Public Health at Hudson University. Dr. Nadia Mendiola, Child and Adolescent Psychiatrist serving inpatient pediatric psychiatry at Northern Light Acadia Hospital. Chris Faccini, Manager of Media and Multimedia Strategy at Northern Light Health. Dr. Jim Jarvis, Senior Physician Executive at Northern Light Health, serving as Director of Clinical Education at Northern Light Eastern Maine Medical Center. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on health in the headlines. Dr. Jarvis.
Well, thank you, Ed. First slide, please. So today is actually the end of the federal public health emergency. I continue to get asked, what does that mean? It means a couple of things. The first and foremost is that we are in a much better place now than we have been pretty much for the last 3 years. And I say that in terms of looking at people who have severe health conditions infected with COVID that require hospitalizations. Hospitalizations are down here in the state of Maine and across the entire United States. If we look at overall number of people who are infected out in our communities, that number also is at one of the lowest points it's been since the pandemic. So that's the good news. Really, though, all this is an administrative issue. So the federal government declared a public health emergency way back in March of 2020. And during that time, it allowed the federal government to have certain ways that they could go around the normal process of politics and budgetary restraints in order to help people. And we've come to a point now where almost all of the resources that are used to help continue to fight COVID-19 are done at the local and state level. So the federal government no longer needs to have that kind of ability to get around the normal process that happens in Washington. What it doesn't mean is that COVID-19 is over. We continue to see that we have still a large number of people who die every day from COVID-19 across the United States. Thankfully, deaths here in Maine are very, very low. In fact, as of the end of 2022, COVID-19 still remained the 4th leading cause of death in the United States. It has probably slipped a little bit lower down in that number, but still a significant amount of mortality that happens due to that virus. It also made some changes in restrictions, though. So here in the state of Maine, most healthcare agencies have gone to what we call a mask optional policy, meaning that instead of needing everyone to wear a mask universally in any healthcare facility, they're being done only in times when they're needed, or if somebody feels that it makes them feel more comfortable wearing a mask. And so I just want to point out to everybody that if you want to wear a mask in any healthcare facility, please continue to do so. And if you want your healthcare team to continue to mask, please ask them to do so. We're also seeing that visitation restrictions have been loosened a little bit in some areas. And so you want to check with whatever particular facility that you might be visiting, what those visitation restrictions may be now. I don't think we're going to go back to completely open visitation across the board in most hospitals, because we actually found that limiting visitation actually improved care because hospitals were quieter, people had more time to rest and therefore get better. And so there'll probably still be some restrictions, just not the intense ones that we had during the last 3 years. There are some changes to COVID-19 vaccinations. So recently, both the FDA and CDC authorized a second bivalent booster for those individuals who are over the age of 65, or any individual that currently is over the age of 12 and may be in an immunocompromised condition, such as being treated for cancer or having some severe chronic illness that puts them at high likelihood of severe disease should they contract COVID-19. I recommend that if you think that you're in one of those categories, that you reach out to your healthcare provider to see if you are eligible, because there is a time constraint between when you received your last bivalent booster and when you get the next one. There's also another couple of changes around COVID vaccines that actually make it easier on our end as healthcare providers. It makes the administration of vaccines a little bit easier. And now we, for both Pfizer and Moderna, the only vaccine that's available for those two products are the bivalent vaccine, meaning we won't have multiple products on our shelves, which is good news for us. And then lastly, I just wanted to touch on measles. We did have a case identified of an individual who had measles here in the state of Maine. The good news is that I understand that individual is doing well. And even better news is that we do not feel that this is going to be any widespread concern for the general population, that the conditions around this particular case make it so that the likelihood of an outbreak and a widespread spread of measles across Maine is unlikely. However, this is now a word of caution. Once again, we must emphasize that vaccination is our single best way to protect us against diseases such as measles and COVID-19, both of which can have fatal consequences. And with that, I'll turn it back over to you, Ed, if you have any questions for me.
I do, actually, Jim. I'm going to grab on to measles a little bit. I mean, you chose to share with us today that a case was reported in Maine. Like, okay, well, there's a lot of cases of a lot of things. Why is this one worthy of like drawing everybody's attention to?
Well, because it's rare. I've been in practice now for 30 years. I've never seen a single case of measles. Why? Because we had widespread vaccination and most people believed in vaccination, particularly vaccination of children, until a very recent movement where there was a much larger percentage of the population that remains unvaccinated. Measles is a significant concern because prior to the measles vaccine, children had severe illness secondary to measles, and many of them died. I think people kind of thought of measles as, oh, it's just one of those childhood diseases everybody gets, until your family is affected by a child who has a tragic incident or dies from measles. And so vaccination nearly wiped that out as a phenomena. Unfortunately, now we are seeing pockets of measles return in and around the United States. We have not had a case of measles here in several years, and so it was pretty significant for us in Maine to report a case of measles. Thankfully, like I said, I think it's going to be a contained and isolated incident.
So if we go back, I don't know, maybe about 2.5 years ago, I remember as we were learning about COVID-19, we were looking at R factors and how quickly a virus can be transmitted one person to the next. And one of the markers, the benchmarks, if you will, was the fact that measles was the most highly contagious, most easily transmissible virus that we were aware of up until COVID-19 taking it over. So that kind of puts a perspective on it a little bit, that this can get away from us in a hurry, particularly if broad groups of people are not vaccinated. Hmm.
Absolutely, and that's what people saw definitely during the 50s and prior to that, before measles vaccines became widely available, and in fact being vaccinated worldwide helped to cut down the spread of measles.
Well, I appreciate that you brought this up today. I do have another question going back to COVID-19. So last month we were seeing XBB 1.5 gaining momentum as the predominant subvariant. And then I actually asked you about XBB 1.16, which is dubbed Arcturus, kind of sounds kind of scary. And that was expanding across the world. This month we're seeing XBB 1.9.1. And that's expanding worldwide. And as I was like looking into some details of that, there's also an XBB 1.19 and lots others. So these changes are coming fast and furious, pardon the cliche there, but what's going on from your perspective, and how concerned should we collectively be?
Yes, those are great questions, Ed, and it comes down to what we've talked about before. It's biology. And so this particular coronavirus, going all the way back to the original time that we identified the coronavirus that causes COVID-19, is very susceptible to mutations. And we're now learning that it's very susceptible to combine the RNA, it's an RNA virus, with from other coronavirus in the same family. And that's really what we're seeing now with a lot of these variants. Thankfully, almost all of the circulating variants that are out there are all in the Omicron family. And we've been talking about Omicron for a very long time. So these are all subsets of that Omicron variant. This new one that you just talked about, XBB 1.9, is actually an older in the family of an older Omicron variant than some of the other XBBs that we've been talking about over the last couple of months. It also seems to be one that's kind of basically somebody probably was infected with two different members of the Omicron family, and the genetics got mixed around a little bit and created yet another new variant. Whether we should be worried or not about these particular circulating variants, we really don't need to, because we know that the vaccines that we have are still very highly protective against severe disease and death, and that's really good. We also know that most people have been recently infected with an Omicron variant, which also gives them some protection. The concern we should have is if any one of these new variants creates yet another new variant that can escape our immune systems and cause severe disease and death. And so that's the thing that we always have to be vigilant about. It's the reason why we need to continue to take this seriously. But again, we are in a very good spot in time, more so than we have been in the rest of the pandemic.
Great. Well, thanks for that, Jim. I'm going to go back to measles just for a second. One of our participants raised the question, do we know the vaccination status for the Maine measles case?
Yeah, I cannot go into details because this is a single isolated case. I am not privy to all of the health information there. So I have no details to talk about that. But I will say that, again, from a public health standpoint, we are hopeful that we are in the clear on this one.
So what we do also know is that the measles vaccination really confers great immunity. So we're not hearing reports of breakthrough through that vaccination. So, we can infer from that possibly.
Yeah, and so and I will state that measles is a very different kind of virus than the one that causes COVID-19. It's a very stable, very large virus, so it doesn't change, which is the reason why the vaccine works so effectively in preventing the spread of measles.
Excellent. Thanks for tackling that. Well, thanks, Jim. Our next
You're
speaker
welcome, Ed.
Yeah, great. Our next speaker is Dr. Nadia Mendiola, who will speak about social media, technology, and the pediatric population. Dr. Mendiola.
Thank you, and thank you very much for having me today. My name is Dr. Nadia Mendiola. I practice pediatric psychiatry at Acadia Hospital on the inpatient unit. Today, I'm here to talk to you about social media and technology in the pediatric patient. It is something I very commonly see on a daily basis that is either contributing or directly leading to a hospitalization. A lot of times I wonder to myself, as I'm just seeing it here in my kids and directly with my demographic. But as I was reviewing literature, I really came to understand that this is not just my population. This is pervasive problem, not even just in the United States. It is absolutely worldwide, from the United States to Egypt to Morocco to Ireland. It is everywhere. So as we discuss today about social media and technology, it's really important to note that this is not just isolated to our youth here in Maine. It really goes much broader. And we are really indeed being faced with a generation that is having a completely new experience of life due to social media and technology. So we're going to begin by kind of talking about what we actually advise our families to be doing. So from 0 to 18 months, we really want you to limit it to just FaceTiming, video chatting. From 18 to 24 months, it should be limited to just educational screen time, and with the emphasis on with a caregiver. And from 2 to 5, it's non-educational screen time, an hour per weekday and 3 hours on weekends. And 6-year-olds and older, no dedicated time limit, just to encourage healthy habits. What we actually see is from years 8 to 12 years old, it's usually up to 4 to 6 hours screen time, and that includes television, gaming, smartphone use as well. This has increased since COVID-19 as well. Kids aged 12 years and older, it's about 9 hours outside of homework time. More recently, in one of the articles in JAMA, there was one that's saying ages from 2 to 5-year-olds is on average about 2 to 5 hours of screen time as well. One study noted that after COVID-19 pandemic, 48% of adolescents spent a mean of 5 hours per day on social media, and 12 hours spent more than 10 hours. So seeing the difference of what we recommend and what we actually see is fairly impressive. So let's take a look at what some of those risks are that we're seeing coming out. So first, I want to mention that all these risks listed here were obtained from a literature review, mostly targeting social media, though some is looking at technology risks in general. Secondly, the literature is talking about more of a correlation between social media and technology usage and these risks versus the actual causation, which I think is something that needs to be distinct. Pardon me. So the most cited risks were depression and anxiety. One important note that research is of the research was to show that the depression scores, as well as the intensity of the depression being reported, increased with every hour of social media use. In some studies, it actually showed that every 30 minutes of social media use showed an increase in the intensity of the depressive scores. In one study, children who had increased time spent on smartphones, social media, gaming, and in general internet use had significant elevated depressive symptoms as compared to children with decreased time. So there's a plethora of evidence showing that depression and anxiety absolutely increases with social media use. The next most commonly seen risk is related to diet, unhealthy eating behaviors, body image, as well as just leading to the increase of obesity and poor nutrition choices and eating disordered habits. Part of this is due to the advertising for junk food that comes up in pop-ups. Children are uniquely vulnerable to the pervasive effects of advertising just because of their immature critical thinking skills and their impulse inhibition. This leads to a correlation between obesity and dental caries. There's also a bombardment of unhealthy messages on media promoting low nutrition elements as well as sugary sweetened drinks. This is not even including the newer influencers that are coming up on the new platforms, which really promote pro-anorexia messaging. This is one of the most commonly things we see in our unit is youth struggling with these messages and presenting with eating disordered behaviors. Cyberbullying is a really significant risk as youth are getting more opportunity to bully more anonymously. Unfortunately, rates have increased in cyberbullying. It's associated with higher risk of depression, anxiety, and suicide than are the traditional form of bullying. And when you think about it, it kind of makes sense, given that it's not just one comment. There's usually comments underneath that just make it that much worse. One meta-analysis of 34 studies showed traditional bullying increased suicidal ideation by a factor of 2.16, which is significant, whereas cyberbullying increased the factor by increased by a factor of 3.12. There has been noted risk factors to be cyberbullied, and that includes being female, pre-adolescents between 13 and 15 years old, sharing your gender on social media, problematic social media use, so increased use, as well as the type of platform used. Tumblr, Snapchat, and Facebook were the biggest ones mentioned. And mind you, this predated TikTok. Technology addiction is something parents ask about all the time. Warning signs include skipping activities, meals, homework, weight loss or weight gain, depending on sort of deciding not to eat, to just do technology versus munching a lot. A reduction in school participation, increased impulsiveness, changes in mood, lying more, and just a loss of interest in anything else. They found that smartphone addiction correlates to both fear of missing out as well as boredom. There have been some scales developed to try to screen for smartphone addictions. The most commonly used one that I've seen is the Digital Addiction Scale for Children. It's been validated to assess behaviors in children 9 to 12 years old. And then the final risk I wanted to touch upon is sleep impairment. The use of computers and smartphones among adolescents is associated with daytime sleepiness and fatigue, shorter sleep duration, later bedtimes, and unfavorable changes in sleep habits. Social media use in particular has also been related to having a higher odds for bad sleep quality. They specifically brought out YouTube. YouTube users have been shown to have 2 times higher odds for sleep onset difficulties. And when we look at the usage between ages, our toddlers and our preschool population are the ones that have been using YouTube a little bit more often. So, though I could spend many hours discussing the risk of social media and technology, there really are a lot of benefits. So I want to spend a little bit of our next time talking about those benefits. I think the biggest benefit to be said about social media has been that it's helped a lot of children be able to maintain social contact, particularly during the COVID-19 pandemic isolation. I've seen it help a lot of kids, especially in our rural communities, being able to connect to communities they might not have access to. For example, our LGBTQ communities, or if they're a minority and looking for some cultural pieces of their life, they really are able to go out and search for those things. It also gives them a platform to maybe speak more freely, which can be a benefit or a risk. But again, with monitoring, it really can offer them ability to speak and be heard. And then finally, it gives a really good opportunity for quality time if it's used appropriately, which I think a lot of sometimes families do take into consideration. So finally, I just want to touch upon some of the recommendations I usually have. The greatest mitigation strategy found upon literature is really parental monitoring and educating, starting from the time you start them on screens and moving forward, not only on the risk, but really how to use technology appropriately. Modeling has been the most appropriate and easiest form to try to help with that. So modeling for your kids when you're using your technology, and not only to use it, but understand why content might be risky or might be good and appropriate. Having periods of no screen times is also extremely important. It helps show them that you can have fun quality times without screen as a family, but also individually, that individually they can have really good quality time with themselves, and it can be achieved outside of screens. And if you really feel like your child or your loved one is struggling with technology overuse, please reach out to your family doctor or a psychiatrist to be screened, so we can also help add some guidance and just help add some extra support. So I really hope that this highlighted some of the risks to consider as you work with youth and as you work with your product. And I thank you very much for your time.
Well, thank you, Dr. Mendiola. Next up is Dr. David Prescott, who will help us understand social media and technology and the various impacts on our brains. Dr. Prescott.
Thanks, Dr. Gilkey, and thanks, Dr. Mendiola, for covering a bunch of very important topics. But in this part of the presentation, I'm going to try to take us to how we think social media and digital technology may be impacting our performance on the workplace. I'll also touch briefly on how it impacts adult mental health, many similar ways to what we just heard about adolescent health. And to do that, I'm going to have to take you a little bit into some basic brain science and how our brain processes information to lead to how we think it may be impacting people's performance in the workplace. And I hope you'll be able to use this both in reflecting on your own social media use at the workplace, as well as those of you who are in supervisory positions, how you can perhaps help your employees keep social media and digital technology in its place. We have found that digital technology and social media use impacts how the brain develops. So looking at very young children, what we find is that the amount of time they spend in front of a screen using digital technology impacts brain development, mostly in negative ways. We've looked at this in a few different areas. One of the most striking findings is that increased use of screens and digital technology, if you will, kind of parking your kid in front of the screen for many minutes or hours in a day, slows language development. So we see that these children who have high screen and digital technology time, their language development occurs later than we would expect for normal development. It also, if you get down into the brain matter itself, it reduces neural connectivity. One of the things that our infants and children are doing is they are growing brain cells, but more importantly is the networking that happens among brain cells. So most of the processes that go on in our brain are involved with neurons connecting with each other, like neighbors or friends. And we find that there's reduced neural connectivity if you spend a lot of time with digital technology and screens. Not only does increased exposure to digital technology slow down brain development, but it starts to impair some of those basic skills that we want our kids to develop. For example, their ability to recognize emotions in other people. This gets worse the longer that you sit in front of a screen, if you will, as a child. So we find that in the developing brain, increased exposure to digital technology, to screens, slows down a lot of those processes or disrupts what we would consider normal brain and skill development in children. As Dr. Mendiola said, the mediator in this is parents using technology with their kids in a helpful way. So you can, if you will, make some of these go away. It's not necessarily bad for you as a parent to use some type of digital technology with your child, as long as you're interacting when you're doing it. You're not only teaching them appropriate ways to do it, but you also seem to reverse some of these language development and neural connectivity problems that develop if it's just your kid staring at a screen. Jumping ahead quickly from some of the research on infants and children, I want to talk about how we think that social media use, so think particularly if you have your phone off to the side of your workplace or on your computer screen and you have a lot of different feeds coming up, how does that impact your cognitive and mental processing and eventually your work performance? Think for a minute about all the things we ask our brain to do. So while we're doing some kind of task or work, and including this kind of thing, watching a presentation, our brain has to be doing several things at once. It needs to figure out what we want to pay attention to. That is, do I need to focus on that? All of us have seen when this gets messed up, we become, for example, highly distractible. We're waiting for a phone call or waiting for somebody to come by, and we're constantly switching, what we call switching attentional set. The second thing our brain has to do is it has to have some working memory. So it needs to hold on to a few items of information. Okay? Well, thank you for going back. Yeah. Third thing we need to do is we need to be able to concentrate, to stay with the task and not get distracted and pull things out of our working memory. And the last thing is we need some executive functioning. We need something to decide what our brain is going to focus its energy on. And before we move to the next slide, what I want you to take away from all of this is that the amount of capacity we have to do all these things is limited, right? Think of whatever, a bucket full of water or something like that. And if we ask too much of it or fill it up too much, our brain gets inefficient. It doesn't do well with the tasks. So, and now moving on to the next slide. One of the things we find is that, and this is where social media comes in, that attentional switching or multitasking, we call it attentional switching in psychology, typically leads to what we call cognitive inefficiency. That is, you're not as good at solving problems or doing work when your attention is having to constantly shift back and forth, such as paying attention to different feeds and screens that may be coming up in your mental space. And what we find is that many people think they're very good at this. They think we're very good at multitasking, right? So what we think we do, like the rabbits on the left, is we're able to make these jackrabbit switches from task to task or process to process. What we actually do, this takes a lot longer, like the snail on the right, than we think it does. This is one of the biggest problems in distracted driving. We don't think that it's taking us that long when it really is. And the other thing is that our ability to do mental tasks gets worse because this attentional switching is, if you will, draining our mental resource. So typically, having a multitasking situation is not going to help you be productive, be efficient, and be a good worker. We do find, however, that not all people are equal with this. So one of the things we're also starting to find is that people of different age cohorts, people who have grown up with a lot of social media and digital technology, really are better than people who have not grown up at doing this kind of multitasking and switching. And we're starting to think that actually these brain connections that people who have grown up with a lot of this use, the mental pathways they use to switch attention and solve problems, are different than those of us who didn't have social media and multitasking situations common in our lives. If we didn't grow up with it, we actually think our brains are handling it differently. So if you're a supervisor or a parent or something like that, and a younger person argues to you they really are good at this, they may not be great at it, but if you're an older age cohort, they may be better than you are. The next thing that I want to talk about a little bit is back to attention again, how repeated exposure and length of exposure to digital technology, spending a lot of time on screens, affects our basic attentional problems. What we're finding is that people who use a lot of screen time, who are often on platforms like YouTube, switching videos, on TikTok, scrolling through things, or playing a lot of video games, they actually appear over time to start to develop ADHD-like symptoms. It's as if that increased screen use is perhaps reprogramming their brain a little bit to look like somebody who has attention deficit disorder. We're quite concerned with this. It's when the people get into other venues, when you're trying to do something else other than scroll through screens or scroll through videos or play a very exciting video game, your brain acts like it has attention deficit disorder. And we're concerned that for some people, we're developing a problem that they can't focus and can't concentrate on those type of things. So I'd say a word of caution there. Let me move now to how we think that social media use and digital technology helps or hurts employee performance. And I think the answer is we really don't know yet, because workplace performance is very varied. Jobs have a lot of different things they call on us. And even if we focus on a specific job, we don't really know yet. We don't have the research to know whether it helps or hurts. But let me talk about a few of the things we're studying, and it may help you in your own work or as a manager or supervisor, what conversations to have and what things to be looking for in your employees. One of the ways that social media affects us, we've talked about this a little bit, is what we call attention impulsiveness. So this is where is easy to get distracted, to switch attentional set because you have social media feeds coming up on your screens. So if a person or you have a job where you don't want to switch attention a lot, quite simply, you've got to turn it off, because our attention just really, remember, it drains our overall cognitive resource. We don't have as much mental energy left over. A second area that we're starting to look at is people who have a proclivity toward what we call online vigilance. Online vigilance is that you have a channel of your brain that's always wanting to check whether one of those social media feeds is giving you some information. So the words I use for this is, let me just check my phone. And again, we're starting to find that some people's performance goes down because they're always running another channel in the brain as, maybe there's something there I should check, maybe there is something I should check, and then they go look. A third area where I think that social media or digital technologies may be helpful is with people who have really boring tasks. And we know from our studies that sometimes if you have a really boring, repetitive task, you can show better performance and stay with it longer if you have something to distract you. So a classic thing would be listening to music while you're doing something that doesn't require a lot of brain power. So we're starting to study what kinds of workplace functions. It helps you regulate your emotions. Essentially, you don't get bored or you don't get anxious because you have some other channel that's helping your brain go. And the last thing, and we talked a little bit about this, is we're looking at multitasking. Sometimes it's whether you can do several tasks at once. Sometimes it's kind of a classic, can you listen to me and also look at your phone? My kids have argued this to me for years. So we're starting to look at these things. I would say we don't really know about how they impact worker performance. I want to cover two other things, sleep and mental health. And as Dr. Mendiola said, with adults, as with adolescents and children, we find that digital technology and social media is really, really, in general, bad for your sleep. So this is a common thing I see clinically. I'm a clinical psychologist as well. People who don't get enough sleep, the first question I ask is, do you have your phone on in bed before you go to bed? Let me briefly go over some of the areas of sleep. We find that people who use digital technology and social media more, they don't sleep as long. Their sleep is less efficient. The restoration that you need doesn't happen. There's some evidence that decreased brain gray matter occurs, and that the LED light exposure alters your circadian rhythm and melatonin production. So we're finding significant impacts on sleep. The last thing I want to say is that with adult mental health, as with adolescent mental health, there are some things that social media seems to not help with to cause problems in some places where it helps us with our solutions. So very similar to what Dr. Mendiola said, we find that use of social media tends to be correlated with an increase in depression and anxiety, and those problems seem to get exacerbated. We've also found, and if we can move on to the next slide, that for some people, it does help increase their social connectivity. We know that social support, regardless of mental health problems, seems to help mitigate or minimize the problems associated with that. So with that, I will turn it back over to Dr. Gilkey.
Well, thank you, Dr. Prescott, and thank you for bringing squirrel into my vernacular.
You're most welcome.
Thank you. Our next speaker is Chris Faccini, who will speak about social media as a business strategy tool. Chris?
Well, thank you, Dr. Gilkey. I'll try and look out for the squirrels out my window. And thank you to Drs. Prescott and Mendiola and Jarvis for some enlightening presentations that I think pave the path for what I'm going to talk about a little bit, which is about the use of social media as a business strategy. Now, I think a key takeaway here, and we've heard this already, is that social media is a tool. It can be used for good or evil, depending on the intent of the user. But there is no question that it has applications for business and that there are risks and rewards, and it's all about maximizing rewards and minimizing risks. There's no question that across the globe, this is a way that people tend to share information. This is global active users among some of the bigger platforms as of January of this year. As you can see, Facebook is still the dominant leader with 2.9 billion, but YouTube and Instagram with 2 billion, more than 2 billion apiece, and TikTok, which is one of the newer platforms, is growing in popularity as well. Speaking of growth and popularity, it's important to look at growth of platforms. As technology changes, as viewer habits changes, platforms popularity changes. So we said Facebook was the biggest platform in terms of global users, but if you look at growth, TikTok is the fastest growing platform. Why is that? It's because of the delivery method and the content. Short form videos delivered in a scrolling vertical format is a very popular way for people to receive information. And if imitation is a form of flattery, then TikTok should be happy that some of the other platforms like Instagram and Facebook with Reels and YouTube with Shorts is copying and adopting kind of this strategy. So a little talk about what we use in terms of social media platforms for Northern Light Health. These are our platforms. Facebook is our oldest platform. We have the most accounts and about 63,000 users. Instagram is one we use as well. It's growing in popularity. It's one we're using for recruiting. I'll get into that a little bit more in a bit. LinkedIn is one that's growing in popularity. YouTube, we don't have a lot of followers right now, but it's growing as we've increased our video production capabilities. And TikTok is one of our newest accounts. I believe we launched that last September. So it's fairly new, but it is growing and seeing some growth. Twitter we've had for a while. We don't use it a great deal. It's a great site for attracting news professionals and getting out information quickly. And Pinterest is one that, quite frankly, we haven't explored a lot as we've been focusing on some of the other platforms. So I said I'd talk about some of the rewards and risks. We'll talk about some of the value of social media first. It's a platform that allows you to connect with your audience in ways that other traditional platforms haven't been able to do. Engagement, it allows you to engage with your audience. Engagement is a metric that measures your audience interaction. This is things like likes and mentions and shares and comments, comments being one of the most important ones there. It's a great tool, again, for employee recruitment and retention. There are great ways that you can use social media to reach out to prospective candidates for jobs in ways we haven't before. We do have a video of one of those ads I'd like to show as an example if we can.
Prior to coming to AR Gold, I was a cook for 20 years at a restaurant, and then it got closed down because of the pandemic, and I like to cook and feed people, so obviously the hospital was hiring, so I came here. In a restaurant environment, the customer gets to order whatever they want. In a hospital environment, while the patient can order what they want, there's dietary guidelines that you have to adhere to, and different types of preparation that you have. And so I like that different type of challenge. I like to feed people in general. That's what I love. I love to cook. I like to cook a variety of things, and at the hospital you get to cook a variety of things.
So what's great about that is you get to see a little bit of the culture. You get to see one of the employees who's working there. You get to see the facility and the area you'd be working in. Then you can link to your information about your company, an application for people to sign on. And you can also have comments that come in your comment section where you can interact with job candidates. So this is a way that we're using more and more frequently to try and recruit employees for positions. And the last part or value of social media, obviously, is to promote your brand and promote your services, your products, but also your values as a company. That's becoming more and more important in social media, is to share your values and who you are and your identity. And remember, I talked about engaging with your audience. Here's an example of one of our ads that we put out there that is promoting our brand and talking about engagement, if we can listen to that. I think you might have to hit play. Okay, looks like we're having problem with that video. I can talk about it. Basically, that's a how are you at? It's one that you've probably seen. No, it doesn't look like it's going to play. That's okay. It's one that we've been putting out there on a number of different channels. And what the How Are You campaign is about, it's really about starting people having conversations, connecting with one another, and then connecting with us and talking about, you know, their healthcare concerns and their healthcare needs. And it's about creating that two-way conversation. And I can share with you how that did on social media versus some of the other platforms that we used. If we can go up, because we do measure metrics, that's an important part of this. But in terms of, if we can actually, if we can move to the next slide, that'd be great. So to show you the importance of social media and getting out your message, these are the different media types that we used advertising for this particular spot. Audio is streaming services like Pandora or Spotify. And by the way, these are in the thousands. CTV stands for connected TV. It's things like Roku sticks or Amazon Fire Sticks or anything that you would connect to a TV. Display is like your typical website ads that also appear on apps. And OTT stands for over-the-top TV. It's anything that delivers video by non-traditional means in a much broader sense, any video you can watch on something that's not a television. And then, of course, paid social. And you can see that we got more clicks on paid social than any of the other platforms. Now, I did say I talk about risks. There are certainly risks for social media as a business tool. Reputation harm is one of them. You can have trolls, disgruntled employees, or unethical competitors that are looking to spread false information or do harm to your business. And so you have to be mindful of that and be prepared to respond when those sort of issues come up. Information security, making sure that you're protecting your company from hackers and people that want to break into your networks and systems for illegal purposes or to cause harm. I think Dr. Prescott talked on some of the HR concerns, employee productivity, if employees are posting inappropriate things during work time, or if there's information also that's unintendedly disclosed by your employer, by somebody in your organization. These are all risks that you have to prepare for and mitigate against. And I'll talk about that in a little bit, but before I do, I'd like to talk about some trends looking forward for 2023. Short form video is going to see the most growth in 2023. This, according to a HubSpot blog, 90% of marketers using short-term video will increase or maintain their investment next year, and 21% of marketers plan to leverage short-form video for the first time in 2023, which is the highest of any trend. Short-term video, there's a couple of different terms or definitions for that. A minute or less is something that I tend to use or think about for that. Another trend is brands with an engaged social media community will win audiences. Again, that's because of the way social media platforms prioritize information. Engagement, posts that drive engagement are ones that usually get spread more further and are seen by more people. And the last thing I'll talk about briefly is influencer marketing, which will continue to grow its high rate of return on investment. Influencers are people that might be experts in a particular field or area that have a built-up existing following, and marketers are turning to influencers if they match their values or product or service line to help them spread their message or share their product or service. And influencer marketing is going to see significant growth in 2023. 17% of marketers planning to invest in it for the first time, and that's the second highest of any trend. So what is a good recipe for social media success? Number one, having a good strategy. Is your social media strategy something that's tied to your business goals, your business objectives? Is it nimble? Are you able to adapt and change to changing circumstances or situations in the social media landscape? Content creation. Are you thinking about content creation in a strategic way? Do you have a content calendar? Are you putting enough resources into the content you create and looking at the best ways to share content with your audience? Engagement. Are you paying attention to the posts and the comments that people are making? Are you answering them? Are you spending enough time and resources making sure that you're engaging with your audience? And finally, having a use policy, and that's to address things like, you know, how your company will use social media, how your employees will use it. What are your expectations for your employees when they're at work? How will they represent your brand? And also who has access to your account, who's allowed to review posts, who's allowed to post things out there, and to review that policy. So that's a way to, again, use social media in the right ways to minimize the rewards and maximize the rewards and minimize the risks.
Well, thanks, Chris. And I'm confident that our audience gives us a buy on the technology, because every single one of us has experienced the technology having personalities of its own. So I now invite all of our panelists to join on video for questions and answers. And Chris, while we're queuing up here, please help us understand what paid social means, perhaps with an example or two.
Yeah, so paid social, there's two types of really social media to think about. Organic, and that's the kind of post that you would use the tools on your social media pages to just try and reach audience members, through, traditional means, just just engagement or reaching out, comments, things like that. Paid social is when you're actually, like any kind of ad campaign, you're putting money, you're trying to reach a demographic or an audience, and you're paying, usually it's a rate per click, of how many clicks you can get from people that are outside your normal network too.
Great. Thanks. And I'm going to grab you for another question real quick. Some of our audience remembers AOL keyword. That's now in the distant past, needless to say. But what's up and coming? What's one platform businesses should be paying attention to as the next possible new thing?
Oh, there are, Dr. Gilkey, there are so many new platforms that are coming out, and it's dizzying to keep up with all of them. Right now, there are some like Post, which is an ad-free alternative to Twitter. You've got something like Sprout Social. Be Real is a new one that is about sharing unfiltered photos because of all the new editing apps that are out there. Lemonade is a place for creatives to come and share content. Mastodon is another ad-free site. We're seeing a lot of ad-free sites that are coming up for people that just don't want to be bombarded or blitzed by ads in some respects. Which ones break free? I think it's important to basically look at, keep on top of those trends and monitor those. And again, like I said, TikTok is one that's been seeing explosive growth because, again, of the way that it shares content.
It sure sounds like we all need a Chris of our own. Great. Well, thanks for that. Dr. Mendiola, I have a couple of questions that have come together, so I'm going to combine some things and answer one from our participants this way. So what can parents really do to monitor and limit the content their teens see? So this one's focused specifically on teens.
Yeah, that's a very common question that we receive. There are a lot of applications out there. The one that has had most success in kids not overriding it has been the application called Bark. Most of my parents have found a lot of success with Bark. It's very comprehensive in its ability. It basically clones the child's phone, so you can see whatever text they're getting, whatever social media they're using. You can put limitations on the social media sites that are allowed on the phone. You can manage the time that's on there. So after a certain time, it kind of closes off the screen or makes it so where the internet goes off, so it's only being able to use as a phone. So it has a lot of capabilities to it. What I find though is that nothing is guaranteed. I find the creativity of kids of how to get around things quite inspiring, even to the degree of having 2 to 3 extra phones. So really what I would say is the best way to overcome that is just really by education and having open conversation and modeling how phones can be safe, but how phones can be put down and life can still go on.
So I'll kind of grab on it. I think you've answered it, but how would you limit your children's screen time and access to social media? So it really sounds like it's a pretty active process and a bi-directional communication.
It really is. It is something that will always be there, and it is something that will always fluctuate depending on your child's current developmental stages and where they're at in life. I think what ends up happening is the more a parent tries to control versus educate, you start to get into the battles between me versus parent. And then the dynamics of breakdowns and suicide ends up growing. Starting from the very, very fundamental younger ages of building up self-esteem, the relationship with the child, educating. There's a lot of books out there talking about social media as well as like taller books of screens and using screens safely. Having those conversations at a very, very early age really is going to mitigate as you go forward. And as you introduce a media device for the child specifically, making sure you're setting up parameters with the child so they know what the parameters are, the natural consequences for those, and explain why. They're going to talk with friends that say, but my friends can do this. And you have to explain why. These are the risks we're concerned about. We absolutely understand that this is not how every household is. We really care about you and we hear you.
And then probably enforce those parameters.
Yes,
Yeah,
follow
that's
through.
that's where some of us kind of dropped the ball, I guess, huh? Yeah, great.
Yeah.
Thank you. Thank you.
Mhm.
Dr. Prescott, we're kind of getting short on time, so think about that in terms of your answer. How does a manager owner treat everyone equally when the multitasking abilities are highly correlated with age? And is there a place for discussing this at staff meetings? I'm thinking about it from an HR perspective as well, you know?
It's a real challenge to treat everybody equally, both because what they actually do are asked to do for their job often differs, and because people are better or worse at it. So I think that I'm not sure there's a really good answer in terms of treating everybody equally, because we also know that as soon as you have different rules for different people as a manager, that's problematic. So I
Yeah,
think you really
exactly.
want to look at what people are asking to do with their social media, right? That's a key thing. What is it? What do you just want to check your messages, or is there something you can show me that is benefiting your work? So I think that discussion, exactly what are we talking about here, rather than blanket kind of policies, is probably a good place to start.
Yeah, and probably that open transparency amongst the whole staff is important. Great. Well, thanks, David. Nadia, I have one more quick question, and I'm sorry we're running out of time, but how often are you hearing cyberbullying as part of your inpatients stories? And then I have a follow-up. What other aspects of social media and technology are playing a role in the patients you see inpatient?
Yeah, cyberbullying is really, really big in contributing to our presentations. What ends up
That's what I was
happening,
wondering.
yeah, what ends up happening is they get it at school in person and then they get it and it follows them home. There's no escape. And then they go to forums, open forums worldwide, trying to seek validation, and then they get cyberbullied on that. And they internalize that as, see, no one really loves me. I'm not good. Why would my parents even want me if this is what the whole wide world thinks? And that leads to depression and anxiety and then the suicidality. I'm very fortunate that the kids make it here and they don't complete the suicide, but that is what we see. The second thing we see is the more eating disorder behaviors. Everyone else looks like this, not understanding that there's filters and I don't, and there must be something wrong with me. So if I do these things, I can. And because they have really bad judgment as kids, they, instead of looking for healthy skills of saying, okay, maybe it's not that, they then go seek out platforms in which that is reinforced.
Great.
And then, yeah, and the third piece is just because of the social interaction, mostly by digital, they really can't pick up tones and they can't pick up any behavioral body communication. So they misread it all the time. So it increases their anxiety and that leads to parental and child as well as peer conflict.
Okay, well, thanks, Nadia.
Mhm.
Well, we have reached the end of our scheduled time. We've included resources for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists for such great information. I hope this hour helped you to expand your understanding of social media and offered you several ideas to apply to your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on June 8th. Our topic will be men's health. This will cover heart disease, prevention and screening of other diseases, and uncomfortable topics people deal with but don't like to talk about. Lots of great learning is in store for us. I hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon.